So I thought we might kick off with just a little, if each of the panelists wants to just say a few words about the topic of digital
recording in progress
mental health interventions. Great, we're being recorded. So Aoife, do you want to kick off and as a GP and the lead for mental health with the Irish College of GPs, will you give us a sense of your perspective on digital mental health interventions?
Hi, yeah, so I suppose positive is the first thing to say, that we and the ICGP are delighted that the HSE has undertaken to increase kind of access to digital mental health interventions. As you know, in mental health, and I think all over the health service, waiting lists are the bane of our lives. And also the difference between people being able to get free access versus having to pay for it, particularly in mental health, because unlike in some other interventions where it might be a one-off, clearly in things like cognitive behavioural therapy, it requires, repeated or multiple visits, and those costs can add up very quickly. So we very much welcome having free access to all, not just medical card holders, but to all of our patients. And the fact that there's no waiting lists, both of those. Another thing that we do welcome would be, I suppose, the knowledge that the intervention is, it's a good oversight, that the therapists are trained, that they have a good system with clinical psychologists overseeing work. It's always a worry for GPs at the coalface that anyone can do sort of an internet course and put their card up in Centra, and you don't know what sort of quality the patient is receiving in terms of their interventions. So we welcome the fact that the kind of quality control is good as well, while recognising that at the same time digital interventions aren't for everyone, that some people don't like it, some people prefer real life people and one-to-one. And for some people, we just not to forget generational issues, that not everyone is comfortable or has access to the internet or is happy to use it. So we welcome it, but we welcome it as part of mental health care, but a very welcome addition.
Brilliant, thank you very much. So we'll come back to you shortly, but in the meantime, Derek Chambers, maybe you might tell us a little bit about how the HSE views this space, and then we'll lead into the SilverCloud piece.
Okay, thanks, Paul. I'll speak broadly first if I can. So just in terms of where I'm coming from, I work for HSE Mental Health, and if we think about mental health as a service, or if we think about mental health as a population, or if the people in this room think about mental health, we don't have a shared understanding. We don't have a common approach to what that means, and that remains a challenge in terms of how we deliver mental health services more broadly. I suppose to be a bit more specific, when we talk about mental health, we're often thinking in terms of the tip of the pyramid of need, or we're talking about mental illness, or we're talking about mental health difficulties, rather than a broader public health approach to mental health. And that's what we have responsibility for within the HSE and within HSE Mental Health. From that perspective, digital mental health has been a really kind of fertile space for us. So we've been able to do things in the digital mental health space that are more challenging in the delivery of face-to-face mental health services, or health services that support mental health. So in terms of what we've done or what we're doing, there was some work developed in this space going back a good number of years, but kind of formalised around 2018. So in 2018, the Digital Mental Health Service Improvement Project was stood up, and that was designed to develop a number of innovative services. So some of the services that were looked at included SilverCloud, included guided online CBT. It also included a dedicated text-based support service. And when COVID hit, all of a sudden this project that didn't really have a lot of attention on it became very important. It became one of the things that we could pivot really quickly and scale up really quickly. So it's been mentioned by others already today, the impact of the pandemic and the influence of COVID on digital health solutions. We definitely saw it with digital mental health solutions. So we were able to accelerate what had started using a 5-level approach to digital mental health supports. So really, really quickly and just at a very kind of high level, we've been developing our information-based and mental health promotion resources, self-help supports, and that can include self-guided online CBT, including the services that SilverCloud offer. Person-to-person supports online are digitally delivered. So one of the biggest services in that space has been the Text 50808 service. I'm not sure if people in the room are familiar with it, but it's a crisis support service that's now managing about 4,500 conversations per month. It's something that's scaled up really well, and it's working really, really well. The next level would be around community-based and primary care, digital mental health supports. So that's where our collaboration with SilverCloud and GPs and other referrers comes in. Again, that's something that's really grown, and we're beginning to mainstream it. And then in relation to specialist mental health services, there's been innovation in that space in terms of how we deliver specialist mental health services through things like telehealth, telepsychiatry. So broadly speaking, that's the model we're working to. We're in the process this year of developing and publishing a digital mental health strategy that falls under our National Mental Health Policy, Sharing the Vision. The implementation plan for which was published just 1 year ago, last March. That's kind of it.
Very good, excellent. Thanks, Derek. And Derek Richards from SilverCloud. Tell us a bit about for those who are not familiar with the SilverCloud project and how it works within the HSE.
Sure, thanks, Paul. So SilverCloud is an Irish company, and it's a digital mental health and wellbeing platform. Our background is in academia and research, and spinning out from research in 2012, growing incrementally over a 10-year plus period. And recently we've been acquired by a larger company in telemedicine in general, where we'll bring in our behavioural health, mental health capabilities. There's about 10,000 plus apps available for mental health that anyone could download. And the question will be then, do they all work the same? Or how do you distinguish between those who don't work and those who don't? And there's one answer to it in my mind, and that is that the one that has the greatest evidence base to demonstrate that it does what it says on the tin in its virtual capacity. Because most of them are using cognitive behavioural therapy, which is a well-established empirically supported treatment for a range of mental health problems. But I think with SilverCloud, what we did, and really importantly, was that repurposing CBT protocols for treatment of depression or one or other anxiety disorders needed to go another step, and we need to do our own research at the highest level, the gold standard randomized trials, to demonstrate that in this format and delivering it in this way with a supporter, a trained supporter, you can achieve clinical outcomes which will be on par with a similar service of a brief intervention. I think it's really important to know there's 20 plus years of research that demonstrates the efficacy of digitally delivered CBT. Patients accept it, and overall patients are quite satisfied with the service. And that's important. That's their experience, their personal experience. We've been delivering this in partnership with the HSE for a number of years, and it's been a really worthwhile effort and project. It's more recently gone national. We receive referrals from GPs, primary care psychology, counselling in primary care and community mental health. We triage them, they're brought in, and as Aoife said, there's a huge governance around that. And the standard of that governance needs to be equal to delivering a mental health service in any other setting, and which it is. And that's something we take pride on. What's important is that it's on demand. There's no waiting list. It's straight in entry. Now that's phenomenal in terms of the experience for a patient. Most patients will present for the first time in their lives their experience of symptoms that may be troubling or distressing to their GP. That's just a fact. So at that point, it's really important that we have options. And then we also, at that point, it's really important that we benefit from early intervention, and reduce the risk of chronicity or complexity being developed into the case. We've been delivering the service and we report on those outcomes, and you'll see on our table outside, SilverCloud as a stand outside. Any of you are welcome to pick up the most recent report of the 5,000 completed individuals being treated. And that report will detail both the reliable improvement we find in depression and anxiety symptoms in adults, but also recovery rates, which again are on par with what we would see in the delivery of group-based CBT or face-to-face based CBT of a similar nature. Obviously, most of the groups we service are in the mild to moderately severe, and they do really well in this type of intervention. Going back to what someone else said, it's not a one-size-fits-all, nor is it a panacea, it never will be. It's another intervention in a pathway of care that can be leveraged for its benefit. And then those in more severe symptoms, they do benefit clinically from the interventions, but in many cases they need something more. And that might be telepsychology visits or something more intense, more high intensity. But it's really important that we think about that for the future development of the service. So that's something a little bit about both SilverCloud and the service we're running. Thank you. Thank you, Paul.
Thanks, Derek. We might open up to questions because I think this could go in a number of different directions. And what we probably won't do is go down the path of, well, why isn't there proper face-to-face psychology services that patients can access? And we'll focus on the digital side of things. So has anyone any questions for either Aoife or either of the Chuckle brothers? Yes, there you go.
With rehabilitation services, we can find it difficult to get psychiatric advice for patients, and a lot of them would have mental health issues. Can this digital platform be used without the guidance of a consultant psychiatrist, psychologist, and by a physician who'd be attending these patients?
To answer that, yeah, I'll try. I'll give it a try. Any patient that's referred to this service, and at the moment, I'll just repeat, the sources of referral are from general practitioners, primary care psychology, CIPSI, and community mental health. Anyone that comes in, they enter an experience which begins with an assessment of their needs. And that includes standard metrics like PHQ-9 and GAD-7 to establish symptom severity. Then they're automatically assigned a program that most suits the needs they're presenting with, and they're automatically assigned a coach supporter, a coach or supporter. We call them various names. They're master level clinical psychologists in general, and they're supervised by a licensed clinical psychologist. That's the governance structure. So it's quite robust. So does that answer your question?
It does, yeah. Thank you.
Yes. Do you want to hang on for Hillary's coming down with the microphone for you?
Thanks. Hi there, I'm Gemma. I work here in CHO DNCC in integrated care for chronic disease. I actually used to use the SilverCloud platform when I worked in Berkshire NHS, so I think we've met before. And back then, like it wasn't that long ago, we started to look at chronic disease self-management support on this platform. Is that something that's being investigated as an option for, like, you know, people obviously needing mental health support as well as having a chronic condition?
Really important. We do have a suite of chronic disease a suite of programs that cover chronic diseases, and yeah, hopefully we'll be able to develop the service. I don't know if you want to talk to that as well, Derek, in terms of plans.
Yeah, I mean, look, I work within mental health, but we have facilitated introductions to colleagues across the HSE. So I know that Liam from SilverCloud is here today, and Derek and other colleagues have had conversations with people across the organisation. So I think the opportunity to scale up is certainly there. Yeah.
Thank you.
Can I ask Aoife, I'm a GP and I would obviously have my own views, but I'm interested in the college's view of, is this enough? Is this, could we be doing more than this? Or not discounting the limitations that you mentioned at the beginning?
Is this with regard to the chronic disease management?
No, sorry, we're just going to stick with mental health today, I think.
Pardon.
Look, we would see it as a welcome addition, and but not everything. No, of course, it's not enough on its own. So we know that of GPs that are using the digital mental health service, it's not all GPs are aware of it yet, but of those that are, they tend to be repeat referrers, which is kind of encouraging, that those who have found it and found it useful for their patients tend to continue to refer. So I suppose, you know, that's a good sign. We do know that a lot of GPs aren't aware that the digital mental health services are there. They're not fully, you know, familiar with them, how to refer, the access. So one of the pieces that we're doing is to try and increase GP awareness, particularly given that the HSE is now providing it free of charge, to try and increase GP's awareness that the service exists, while knowing that it's not for every patient. I think it's something like 60% of those referred will actually, you know, proceed and take it up. So we have to be aware that not everyone will do that. And I suppose part of, you know, anxiety, depression, mental health is sometimes that your own motivational levels aren't great. And to be honest, it does take quite a bit of motivation to get online, you know, and because it's very easy to say, oh, look, that's just a website to log in, I'll do it later, and procrastinate. Sometimes an actual appointment with a real person, whether it be on a Zoom or whether it be in real life, is very useful. And I think Derek mentioned that that's a direction that we might be looking at. So it's good. It's not for everyone, but we do need to increase GP awareness, and we are working on that so as to expand the number of GPs that are referring. Another thing that we would like to see is expansion of the packages available. For example, I know we looked a little bit at the insomnia package for managing insomnia, maybe perinatal. We're also, and in the ICGP, part of our remit is looking at chronic disease management, and in two different ways, in looking at whether people with mental health issues can have their physical health followed up through chronic disease management, and also those with physical illnesses, for example, diabetes or COPD, should have their mental health looked at as part of their chronic disease management. So it kind of goes in both directions, and I think there is room for digital health as part of the package in both of those directions. It won't be the full thing, but it can be certainly part.
Excellent. Any other questions? Yes. Just hang on there one sec, and the microphone will magically appear.
It's a question for Derek. Derek, you mentioned earlier on there.
And you're going to have to specify. We've a multitude of Dereks. So
There's two there, actually.
Derek SilverCloud or Derek HSE.
So, Derek, you mentioned earlier on there actually that there was 10,000 apps available for downloading, right? And I suppose in that whole realm, say, of apps, right, is there a regulatory body to oversee the rights and wrongs of those apps?
Not in every country is there. Some countries do have it, like in the US you have FDA. In Australia they published 2 years ago their digital regulation, England the DTAC regulation. So different countries are at different points along their journey for developing their standards for regulating these types of products, especially the products, technology products that are evolving so rapidly. Versus a device that might be done and dusted, like a syringe. It's there, it's not going to change much in short period of time. It's really important though. However, in the absence of formal regulation, there's been a lot of work published on kind of frameworks around the kind of things that customers should be thinking about in adopting digital. So in that case, they point out to things like, well, you need to do an assessment of the usability, the interoperability, you need to assess the privacy and data levels that are guaranteed, and they follow GDPR and HIPAA in the US, and you need to look at the evidence and what evidence they have, not just evidence informed, and this goes back to the point I made earlier. Like, oh, I threw an app together and threw content on it because it's based on mindfulness, and everyone knows mindfulness works. No. I need to test it in this format to show that it moves from evidence-informed to being evidence-based. So you can then say it's empirically supported. Otherwise you can't, in my view.
Well, just to
yes, go on.
add very briefly.
You jump in there, Derek.
Just from a mental health perspective, it was something that we recognised a little while back, and we undertook a small-scale project looking at mental health apps using a thing called the mobile app rating scale, something developed in Australia in Queensland, and that was you know, it spoke to the criteria that Derek had just outlined there, but that was, I think, us just kind of getting started in that space. I think there's an awful lot of potential for us to do more in terms of regulation, quality assurance. But yeah, that was somewhere to start anyways, that mobile app rating scale.
Thanks. This is a very interesting topic. I would agree with Aoife that these kind of platforms have a real role. but it's very important to be aware of its limitations. So we all jumped into these, and it was all we had during COVID. But, you know, we have very good data that shows there's a certain amount of cancers diagnosed every year in Ireland, and that dropped by a third every year. And we're picking them up now, and it's quite delayed. So there's a wave of deaths that's going to happen post-COVID. So there needs to be a system where the people who are interacting with the patients, after a certain time, if there's no progress, they have to have a human intervention. I mean, there has to be a fail-safe. And the question I'd ask is, I deal with gastroenterology and liver disease, and I'd say that's the biggest overlap between mental health and other diseases, chronic diseases, especially alcohol-related diseases. Now we've all heard about COVID and the epidemic of anxiety in the youth, isolation in the elderly, but nobody's talking about the epidemic of alcohol abuse, which is sweeping over our hospitals now. So do you think there's a role with this digital platform where mental health interacts with alcohol abuse or substance abuse generally?
Good question.
I mean, my answer might be shorter than Derek's, I think. It's one of the programs that we're looking at. So my colleague Aisling Sheehan in the National Alcohol and Mental Health Programme and Health and Wellbeing has already begun to make inquiries about whether we can expand this particular type of service delivery into that alcohol and substance misuse space. So it is through SilverCloud that we'll be progressing that. Yeah.
We've time for one more question.
I might just add to the point you made about the need for an intervention at some point. That's catered, like individuals going through the platform, they have a coach, a trained professional in the loop that monitors their progress and has the ability to make a clinical decision under supervision to say, it's not working, they need something different. That's so important. It's about building, understanding 2 points. This or any intervention, they're not miracles, they never will be panacea. And then going back to what Derek spoke about earlier, it's about trying to develop step care modelling so that, you know, you have monitoring functions, you have assessment, you have intervention, you have monitoring, you have the ability to step up or down. And that's the ideal scenario, of course. Thank you.
I'll say one more question, did I see? Going once, going twice. Fantastic. Well, listen, will you thank our panel, Derek,